Our patients, for the most part, have been treated as inpatients. They usually stay in the hospital anywhere from 7 to 14 days. And again, on the clinical trials, we've been seeing these patients frequently. We have to see them on day 8, day 15. They have a PET scan on day 29. So there are frequent visits, pretty much weekly visits. We are insisting that our patients stay within a certain distance to the center. And, in the Chicago area, if you say it has to be an hour, it could be, a mile away, and it could take an hour to get here. But I think we like to have patients within an hour or so of the center. We also are instructing these patients that if they're sick or if they develop problems late, unexpected problems late, that certainly they have to go to a local emergency room, but they're going to be identified as a patient who's just had CAR T cells, and the local emergency rooms will know to be in touch with one of the investigators at the center, at our center, to help manage some of the potential toxicities. And so, and I think by insisting on people stay close and by having caregivers with them at all times, especially in the first month or two, I think is extremely important. And so that's one of the requirements, in fact, for the clinical trials, and I think it's actually one of the requirements for the commercial product as well.
The financial component of this is actually a very important part in two ways. One is it takes time, and one of the reasons why it takes time is because we don't have too much experience with it. CAR T therapy for B-cell lymphoma has only been available commercially for about a year now. So people are learning. The financial consultants who deal with billing procedures and reimbursement procedures are learning about this. The insurance companies are learning about it. But because this is relapsed refractory aggressive B-cell lymphoma, and there's already lags, time lags between seeing a patient and giving the treatment, if there's an extra delay from the financial, due to financial clearance, that makes it a little bit more of a logistic challenge. So these should be handled by financial consultants, specialists who can really expedite the process, knowing how needy these patients are, and take it from there. The second part of it is the regulatory component. This is viewed as gene therapy. So one of the guidelines from the FDA is to be able to follow these patients for up to 15 years. Then the next part of it is the reporting piece, and long-term outcomes for this is very important for us, and therefore the Center of International Bone Marrow Transplant Registry, called CIBMTR, has then partnered with Novartis and Kite Pharma to collect and analyze the long-term outcomes of these patients. So these can be reported over time. Finally, patients' outcomes and events could be reported via MedWatch to the FDA, and they can also be reported by the centers directly to the companies.